This video presents an examination of the musculoskeletal system, including inspection, palpation, and range of motion tests of the head and neck, hands, wrists, elbows, shoulders and related structures, feet, ankles, knees and hips, and spine. In this video, the examiner will assess a healthy patient. Keep in mind that other patients may have the same normal findings or may exhibit normal variations or abnormal findings. The extent of the musculoskeletal examination depends on the patient's condition and symptoms. As you examine the patient, ask him to report any tenderness and be alert to facial signs of distress. Begin the exam by assessing the temporomandibular joint. Place the tip of your index finger in front of the tragus of each ear.
And open and close your mouth.
Then ask the patient to open his mouth.
Good.
Observe the movement of the jaw, feel for swelling, and note any tenderness or crepitus. Next, inspect the neck, including the sternomastoid muscles, for symmetry, deformities, or abnormal posture.
Now let's check your neck.
Then palpate the spinous processes of the cervical spine.
And the muscles of your shoulders.
As well as the trapezius muscles.
Good.
And the muscles between the scapulae. Identify any areas of tenderness. Now test range of motion of the neck.
I'll have you
To
touch
test
your chin
flexion,
to your chest.
have the patient touch his chin to his chest.
Your chin to your right shoulder.
To check rotation, have him turn his chin toward his right
Now
shoulder
to your left shoulder.
and then his left shoulder.
Now bend your head towards your right
For
shoulder.
lateral bending, ask him to bend his head toward his right shoulder
And towards your left shoulder.
and toward his left shoulder.
And finally, tilt your head back.
For extension, ask him to tilt his head back. Note any limitations in range of motion. Check
Motion
range
with
of
your
motion
hands
in
and
the
wrists.
patient's hands and
Take
wrists.
your hands and make a fist.
Ask the patient to make a fist,
Now
extend
open up
and spread
your
his fingers,
and
flex his
your
wrists,
Now extend them.
and extend them,
Now move your wrists
and
to the
move his
side.
hands laterally
And now toward the center.
and medially.
Now let's look at your hands.
Inspect the patient's hands and wrists, noting any swelling, redness, nodules, deformities, or muscular atrophy.
Now let's check each finger.
Now palpate the medial and lateral aspects of each interphalangeal joint between your thumb and index finger, noting any swelling, bogginess, bony enlargement, or tenderness.
Good.
To detect joint fluid more easily, feel for it with one hand while using the other hand to compress the joint antero-posteriorly. To detect tenderness in the metacarpophalangeal joints, squeeze the patient's hand between your thumb and fingers.
Good.
Then examine each metacarpophalangeal joint. Place your thumbs just distal to the knuckle on each side of the extensor tendon. Your fingers should be on the head of the metacarpal in the palm. Note any tenderness, swelling, or bogginess. Next, palpate each wrist joint with your thumbs on the dorsum of the wrist and your fingers beneath it. Now assess the range of motion of the patient's elbows.
I'll have you flex your
To
elbows.
test flexion and
your
extension,
hands all way
have
up
the
as far as you
patient
can.
bend his elbows as much as he can, and then straighten
Extend
them.
your arms.
To check supination and
Now bring
pronation,
your
ask the
elbows
patient to flex his
this,
elbows at
palms
90
up,
degrees and turn his
and now
palms
turn your
up
hands over.
and then down.
Let's check your left elbow now.
Next, support the patient's forearm so that the elbow is flexed to about 70 degrees. Inspect and palpate the elbow, including the extensor surface of the ulna and the olecranon process. Note any nodules, swelling, or tenderness. Palpate the groove between the lateral epicondyle and the olecranon for tenderness, swelling, or thickening. Finally, press on the lateral and medial epicondyles for tenderness. Avoid pressing on the sensitive ulnar nerve.
Good. Let's check your right elbow.
As you inspect and palpate the other elbow, compare findings. To evaluate the range of motion of the shoulders and related structures, assess flexion by asking the patient to raise both arms to a vertical position. Assess external rotation by having him place his hands behind his neck with his elbows out to the sides. Check internal rotation by having him place his hands behind the small of his back. If you suspect a problem, cup your hand over the patient's shoulders and feel for crepitus as the patient repeats the movements. Then inspect the anterior shoulders and shoulder girdles for symmetry, noting any atrophy, swelling, or deformity.
Now let's check the joints of your
Palpate
shoulder.
for tenderness at the sternoclavicular joint,
Good.
the acromioclavicular joint, the subacromial area,
Any tenderness in there?
Mm-mm.
No.
and the long head of the biceps tendon. Now, with the patient lying down, inspect the patient's feet and ankles. Note any deformities, nodules, swelling, corns, or calluses.
Ankle.
With your thumbs, palpate the anterior surface of each ankle joint, noting any bogginess, swelling, or tenderness. Feel along the Achilles tendon for nodules and tenderness. Test for tenderness of the metatarsophalangeal joints by compressing the forefoot between your thumb and fingers. Evaluate each of these joints by palpating the metatarsal head in the sole of the foot and compressing the joint between your thumb and finger. To assess the range of motion of the feet and ankles, dorsiflex and plantarflex the foot at the ankle. Next, stabilize the ankle with one hand and grasp the heel with the other. Then invert the foot at the subtalar joint and evert it. Now stabilize the heel and invert the forefoot at the transverse tarsal joint and evert the forefoot. Finally, flex the toes on the metatarsophalangeal joints. There should be no limitation of movement or pain. Now assess the range of motion on the opposite side. Inspect the patient's knees, noting their alignment and any deformities. Note atrophy of the quadriceps muscles or loss of the normal hollows around the patella. Then palpate the suprapatellar pouch on each side of the quadriceps, noting any thickening, swelling, or tenderness. Also palpate along each side of the patella. Identify any thickening, swelling, or increased warmth. Repeat on the other side. If you suspect a small amount of fluid in the knee, look for a bulge sign. First, milk the medial aspect of the knee firmly upward with the ball of your hand to displace any fluid. Next, press or tap the knee just behind the lateral margin of the patella. Watch for a bulge of returning fluid into the hollow medial to the patella. None is seen here. In another patient, there is a positive bulge sign. If you suspect a larger amount of fluid in the knee, check for a balloon sign. To do so, rest the thumb and index finger of your right hand on each side of the patella. With your left hand, compress the suprapatellar pouch back against the femur. Feel for fluid entering the spaces under your right thumb and finger. If you feel it, a balloon sign is present. If fluid is felt, press the patella backward against the femur with your right hand, as your left hand feels for fluid returning to the suprapatellar pouch. A palpable return of fluid confirms a balloon sign. None is felt here. If the patient has a history of knee pain, compress the patella and move it against the underlying femur. Then push the patella distally and ask the patient to tighten the knee against the table. Pain and crepitus suggest a patellofemoral disorder. Now flex the patient's leg at the knee to about 90 degrees. With your thumbs, press into the tibiofemoral joint on each side of the patellar tendon.
How's that there?
Feel along the tibial margins. Tenderness from a damaged meniscus may be present here. Then palpate along the course of the collateral ligaments, laterally and medially.
Okay, good. Let's try the other leg now.
Assess the patient's hips, beginning with hip mobility.
The other leg on the table.
Ask the patient to bend his knee to his chest, pulling it firmly against his abdomen. He should be able to flex his knee and hip without difficulty while the opposite thigh remains near the table.
Very good. Now let's check other movements at your
Next,
hips.
test hip rotation. Flex the leg to 90 degrees at the hip and knee. Then stabilize the thigh with one hand and grasp the ankle with the other. Now move the lower leg medially so that the femur rotates externally at the hip. Then move the lower leg laterally so that the femur rotates internally. Finally, abduct the extended leg until you feel the anterior superior iliac spine move in the opposite hip. Repeat these maneuvers on the opposite
Now
side.
check on the other side.
Okay.
If a hip is painful or limited in motion, palpate for tenderness in 3 areas. First, palpate deeply below the inguinal ligament and lateral to the femoral pulse for the hip joint and the overlying iliopectineal bursa. Second, with the patient
No
lying on his
tenderness there.
non-painful side, palpate the greater trochanter of the femur
about now?
for the trochanteric bursa.
That's fine.
And third, palpate the ischial tuberosity for the ischial bursa.
How about any?
Finally, have the patient stand and again inspect his feet and knees, noting any deformities.
Okay, good. I'll have you turn around and we'll look at the back of your knees now.
As the patient turns around, observe for any swelling in the popliteal spaces. Inspect the spinal profile, observing the normal cervical, thoracic, and lumbar curves. Also, inspect the spine for lateral curvatures. There should be none.
Now, if you'll
Next,
bend
ask
down
the
and touch your
patient to
toes.
bend forward and touch his toes. A lateral curvature
Good,
may
now
become
back
more
up.
evident with this movement. Then watch as the patient bends forward again.
Good.
The normally concave
Come
lumbar
back.
curve should flatten out. Now sit behind the
Now we'll
patient
check
and
movements
stabilize his
at your
pelvis with
spine.
your hands. To assess lateral bending, have the
Bend your right
patient
shoulder
bend to the
down,
right.
please. Good. And now your left.
And left.
As far as you can. Good. Now bend back.
To check
toward me.
extension, ask him to bend back towards you.
Fine.
And to assess rotation,
twist your right
have him
shoulder
twist his
first.
shoulders to the right
And your left.
and to the left. These movements should be symmetrical and done with ease.
Okay, now if you'll rest both hands on the table, I'll feel along your spine.
All right.
And you let me know if you feel any tenderness.
Sure.
Finally, palpate the spinous processes for tenderness. And the paravertebral muscles for tenderness and spasm.
How about in the muscles here? Do you feel any tenderness?
No, it feels all right.
In summary, examination of the musculoskeletal system includes inspection, palpation, and range of motion tests of the head and neck, hands, wrists, elbows, shoulders and related structures, feet, ankles, knees, and hips, and spine.